Okay, the next topic is one of technicality, and this is still Chapter 2, page 19. This has us think about the level of knowledge that our audience has about the topic that we are presenting. So the question here they've posed is, how much expertise does the audience possess? You can have audience members who are highly technical. Their knowledge about the topic is really great. When you have those people, you'd find that you can use highly technical terms, but you don't have to define them. You don't have to interpret data. You may use abbreviations or acronyms. Say you're in a military environment and you're writing documents for other military personnel. You can use acronyms. That is part of their culture. They will understand that. Whereas if you provide that same document for community members, you may have to spell some of those things out, as the language would be different. Semi-technical audience, of course, is kind of, in the middle somewhere. They have some knowledge about the topic, but they are certainly not experts. So you may have to explain some of the raw data. You may omit some details that just don't matter to them or are too technical for them, and you may have to provide some interpretation, some help with them understanding the documents. And then you've got the low end, which is the non-technical audience, where you will have to do a lot of interpreting. You will stay away from details or lab statistics data that is beyond their need to know, and you will want to use some summarization and explanation. So I have an example here that comes straight from the book, so you can look it up, but it's a good one. Chapter 2, pages 21 through 23. On 21, what they have is an example of a man who has had a heart attack. And they've got the document that is written for his doctor. So I'll read a bit of it. The patient was brought to the ER by ambulance at 1 a.m. on September 27th. Wow, I got that. The patient complained of severe chest pains. Yep, I'm good. Dyspnea and vertigo. Auscultation and EKG revealed a massive cardiac infarction. I know that one because I watch medical shows. And pulmonary edema marked by pronounced cyanosis. Okay, I have no idea what I'm reading here. Vital signs: blood pressure 80/40, pulse 140 per minute, respiration 35 per minute. The lab results: WBC 20,000, elevated serum something, urea nitrogen 60 milligram percentage. Your analysis showed 4 plus. Okay, I'm lost. And it gets worse. Now we're down into xylocaine drips. We're talking about percents D and W intravenously. I'm totally lost. This is not the document for me. If this was my husband who had the heart attack, this document would not be of any use at all to me. But the one that would be of use to me would not be helpful to the doctors. Now, if there was a semi-technical audience for this same event, this might be a nurse or somebody at a care facility in the middle. So here we talk about examination by stethoscope and electrocardiogram revealed a massive failure of the heart muscle, along with fluid buildup in the lungs, which produced a cyanotic discoloration of the lips and fingertips from lack of oxygen. Oh, we have an explanation. What caused that discoloration? Then we do have some numbers. We've got blood pressure, but we have some meaning behind it. That was dangerously below its normal measure of 130/70. We've got some other measures here. When we talked about the pulse rate, we find a definition here that the pulse rate is twice the normal rate, and that the respiration that was listed above is also twice the normal rate. Now, noting that was not important for the doctors. They know what a normal rate is, but it might be important for this person that's falling in this semi-technical level of care. For that level of audience, the same event was explained a little differently. Now we come along, here I am, this is me, the wife. I need some things. I'm not stupid. I do not want them to talk down to me. I need some information if my husband is the one that has had this heart attack. But I don't necessarily need the information above because that is not helpful to me. I want something beyond, honey, he's going to be okay, but I don't need that level. So how would you craft this kind of document for me? Well, heart sounds and electrical impulses were both abnormal, indicating a massive heart attack. Thank goodness they called it that instead of the pulmonary infarction, where I'm trying to guess through my watching of, some whatever I watch on TV, what that actually means. They just line it out for me here. It's a massive heart attack caused by a failure of the heart muscle. There was some lung problems. They got fluid in them, and there was some bluish discoloration, and that was because of a lack of oxygen. The blood pressure, I don't care what it was. Here's the meaning I need. It was dangerously low, creating the risk of shock. Pulse and respiration, you don't need to give me what they were. This business about them being almost twice the normal rate was more helpful to me than giving me a number. All the way down to the end, again, we talk about they gave him some medication to ease the chest pain. Yeah, they didn't have to tell me what that medication was. They gave him some oxygen to ease the strain on the heart and lungs. Thank you. That's helpful information for me as another party, but one who is non-technical. And then they gave an intravenous solution that helps prevent the blood vessels from collapsing. So this is one event with 3 different audiences. The purpose of the document all the way along is to inform, so that doesn't change, but the level of technicality of the audience is different, and so this document needs to be written differently, and the author needs to know that up front and make those adjustments ahead of time.